It's like deep tissue minus all the pressure and acupuncture minus the needles. Everyone says, I want deep tissue. And that might not be the best thing for your body because the body can see that as threat. Like it's too much pressure and your body can kind of shut down. With Electrons Plus, I don't have to use the same amount of pressure that I would without it.
Hello, I'm Dr. Wendy Myers. Welcome to the Myers Detox podcast. And on this show, we talk about advanced topics in healing like heavy metal and chemical detoxification, the health issues caused by heavy metals and chemicals in our environment. I love talking about bioenergetics, and we're going to be talking more and more about anti-aging and other advanced topics as well in health. And on the show today, we have Arthur Robinson. So he is a sports medicine practitioner. He is a physical therapist, masseuse, and we're going to talk today about supercharged massage using a device called an Electrons Plus, which I have been using to get massages for, I guess, about 4 or 5 months now, and it is total game changer. I mean, this device is unbelievable. It takes your massages to the next level. So we're going to talk about how this Electrons Plus device uses PEMF, or pulse electromagnetic fields, to kind of recharge your cells and promote healing, how it pushes electrons into your body to recharge the electrical and nervous system in your body, how it allows the practitioner to kind of like read the body and customize your treatment, and almost doing like a biofeedback session. And it can be really highly effective for pain relief, managing chronic pain, recovering from injuries, dissolving scar tissue, surgery recovery, and treating conditions like neuropathy and innervating nerves like the vagus nerve to improve organ function and even digestion. And we'll talk about how it also allows for a gentler massage. I tend to like a really deep tissue massage, but then I have to recover from the injuries or the inflammation from that deep tissue massage. So using this electrons device can allow you to get really, really deep without sustaining injuries from your deep tissue massage. And we also talk about how this device helps to improve movement and functioning by reactivating dormant areas or muscles that aren't firing, how you can treat old injuries and scar tissue, resolve long-standing issues and pain, improving mobility and physical functioning, accelerating healing and recovering times. And it can be even used on pets and their injuries as well. So a fantastic show today. Our guest, Arthur, is a licensed and certified health trainer, athletic trainer, a ATC, and a licensed massage therapist, an LMT. And he received his Bachelor of Science in Athletic Training from Arkansas State University and Masters of Education in Kinesiology from Stephen F. Austin State University. And he's been working in the sports medicine field since 2003 and has been practicing massage therapy since 2012. Arthur started his own massage and bodywork practice in 2012 called Custom Needs Performance and Recovery. And he performs sports medicine and bodywork services in your home. He comes to you, and he specializes in treating many soft tissue injuries and movement dysfunctions in the skin, muscular, and cellular levels, utilizing various manual therapy techniques and healing modalities, including the Electrons Plus. And each session is customized to the client's precise needs and lifestyle to improve overall performance, helping you feel better and move better. And you can learn more about Arthur and his work at customneads.net. That's CUSTOMKNEADS.net. Arthur, thank you so much for coming on the show.
Oh, thank you for having me.
Yeah, so why don't you tell us a little bit about yourself and your background?
So I'm an athletic trainer, certified athletic trainer, and licensed massage therapist. I've been a certified athletic trainer going on since usually like 2003, and a licensed massage therapist about 2012. I like what I do because I get to help people. That's kind of why I got into what I'm doing. Got my degree in sports medicine, and I knew from then I wanted to help people, and I always wanted to use touch, and that's why I also went to massage therapy school as well, so I can provide kind of both of those services to people.
Okay, great. Yeah, and so I discovered this device that you use through a colleague of yours, and just wanted to get a massage. And so you were the person that trained him. So his name is Christopher Santee, and I was really blown away by this electrons device that he uses, when he's touching your body, you're sending essentially, I don't know what you call it, if it's electricity or electrons, well, not through your body, or it's kind of like a grounding device, essentially. And I was really completely blown away by how much better of a massage you get using this device. And I went to massage school when I was a teenager, actually. I went to two different massage schools, and massage is a huge part of my health regimen my whole life. I have to get a massage at least once a month, and it just helps me manage stress and calm my nervous system and whatnot. And I can't believe I've never done a podcast on massage because it's such a fundamental part of my health regime, and never done it before. But that's why I'm really glad that I met you and to talk about this Electrons device adds a whole other component to it. So why don't we talk about that? So how did you hear about Electrons Plus, which is the device that I have been using to get a massage?
So I found Electrons Plus probably about 7 years ago. I was looking online, either Facebook or Instagram. I was trying to find something else to do besides massage. I felt I was good at massage, but I felt like I was leaving something on the table. Like they felt better, but like, I could have done something different. And with my sports medicine background, I wanted something more diagnostic that I could see, hey, this muscle works, this doesn't work. This is moving, this is not moving. And lo and behold, like 1:30 in the morning, I'm looking up on Facebook or Instagram and I find Electrons Plus. I'm like, wait, it's like the movies. I'm like, my God, that's it. That's what I've been looking for. I mean, he touched this guy's arm and it started moving. I'm like, that's the power I wanted in my hand. And that was the healing component that I think I was missing for myself and my practice and helping others. And it's changed my whole practice. Literally, I don't touch anybody without it. If you want me for a massage, it's gonna be with the Electrons Plus. So I use everything I learned in massage school and adapted it with the Electrons Plus. And it's been pretty much a game changer for me in my practice and my clients 'cause it helps them out. The healing aspect is that much more quicker.
Yeah, I cannot believe how much better I feel in my body, how much better my body functions, and it just really has taken my physical functioning to another level because I was, just having a lot of different musculoskeletal issues and tight muscles here and pulled muscles there and old injuries that just continually plague me. But with the Electrons Plus, I just find I'm not having any of those issues anymore. It's just a total game changer. So what exactly is the Electrons Plus? Like, what is it doing? How does it work, et cetera?
So Electrons Plus is using PEMF, pulse electromagnetic frequency, kind of pretty much pushing the electrons into the body. Since we're all in an electrical system, we need electricity to help move. So I give the analogy of kind of pretty much charging your battery system, charging your cells. Just how we charge your cell phone, plug it in the wall. Well, that's what Electrons Plus is doing for the body. When you're sore, let's say the tight muscles or injured, the electrical system gets shut down a little bit. It's not at the highest frequency it could be. So with the Electrons Plus, we're trying to recharge that, put it back to where, hey, it's optimal and you can use it again. That's pretty much how I use it. If you got an arm and say, hey, I can't really move my arm here, well, I'm gonna run the electrons on this arm and see if we can get it to move a little bit better. I mean, something else is going on in the body, and I use Electrons Plus to help kind of figure out the why. If so, we say in Electrons Plus, if it moves, we know it works. If it doesn't move, we know something else is going on. Kind of like your cell phone. When you plug it up, if you have an iPhone, it makes that little noise, right? That little ding when you charge it up. Well, what if that took 2 to 3 minutes? That means something's going on either with your charger or the phone. So with the Electrons Plus, if it does not move, we know something in the body or the battery system is not working. And with that, we can recharge it and get it back moving again.
Yeah, that's interesting. So when I've had a massage with it, I apparently my traps are like dead or something because Chris is saying, "Oh, it's not firing my trapezius muscles." And so he would really focus on that and work on them to, I guess, essentially charge up that
Hmm.
muscle and get it firing again. Because I didn't
Yeah.
realize he was able to detect that using the Electrons Plus device.
Yeah. And what the cool thing is that when you're working on an individual, you can feel that current in your hand. Like most times, if a spot is, let's say your trap isn't firing, that current's going to kick back in our hands. We can feel like, oh, something's going on there. So now we know we can stay there and push more electrons in and then get it to recharge. But that's a good feeling for me because as a therapist, I still have touch. I still can use my, the power of touch when treating someone.
Yeah, but you're
And,
able to kind of sense things on a deeper level,
yes, yes, on a
with
deeper
the
level.
electrons.
And for me, I give the example like it's like deep tissue minus all the pressure and acupuncture minus the needles. So if someone doesn't like needles, I can't probably, or needles, acupuncture probably wouldn't be a great thing for them. But everyone says, I want deep tissue. And that might not be the best thing for your body, because that can also, the body can see that as threat. Like, it's too much pressure and your body goes and like kind of shut down. With this, with Electrons Plus, I don't have to use the same amount of pressure that I would without it. I use 2 or 3 fingers and it feels like I'm, really pushing down, but I'm using the Electrons Plus, is giving me that assist that makes it feel deeper. And when we say deeper, again, that's on the cellular level, getting that to charge up, because there's a lot of places where you can put Electrons Plus, you couldn't put a 10 unit or a stem pad or something like that. And that's another thing that was the versatility of it also, which kind of sold me on it when I got it 7 years ago.
This show is brought to you by Bon Charge, and I want to take a minute to tell you about one of their amazing products that I'm absolutely in love with. So, there's something I've been doing for about 10 minutes a day, and it's wearing a face mask. But it's not just any face mask, it's this Bon Charge red light face mask, and it's essential to my nightly skincare routine now. And believe me, red light therapy really works. It's well established in the research to improve the appearance of your skin. And how it does that is it penetrates deep into the skin to boost collagen production. It reduces the size of your pores. It reduces inflammation and it eases the signs of aging. Bon Charge's red light face mask makes it so easy to take care of your skin. It's kind of like a mini spa session every night that I'm doing. It can be used easily at home. There's no cord, so you can wear it while you're doing other tasks. Plus, the mask is totally painless and it doesn't heat up, unlike some other beauty anti-aging treatments. Bon Charge's red light face mask has been a game changer, and it's part of my everyday skincare routine now. And I'm seeing such great results already from using this mask. My skin is more clear, it seems more plump and fresh and juicy, and my redness and dark blemishes are fading. So there's a very special offer for all of my listeners. Right now, my listeners get 15% off when you order from boncharge.com and use my promo code Wendy at checkout. So this discount applies site-wide. So that's BONCHARGE.com. And you'll also get free shipping and a 12-month warranty. So go now to get this exclusive offer. That's boncharge.com. And with promo code Wendy, you get 15% off. This is one of my secrets to super healthy, young looking skin. I'm trying to reverse the clock. I'm trying to do everything I can to anti-age. And this is one of the secrets in my toolkit. Yeah, and I love deep tissue massage, but I find myself I like it so deep that I'm bruised the next day,
Yeah.
which
Hmm.
is counterproductive.
Very,
That's
very.
not healing when you're I always make a joke because I love to go to Korean spas and I'm like I want a really angry Korean lady to beat the crap out of me. And like that's like my perfect ideal scenario for a massage, because I like it really deep. But I'm bruised the next day, and I know that isn't healthy, that causing that inflammation. And there's also a lot of people that need deep tissue, but they don't like the way it feels. They can't
Exactly.
handle that pressure, but they need it to work those knots out of their muscles.
And one thing with Electrons Plus is the healing aspect of it, is that it can get rid of bruising in anywhere from 24 to 72 hours. Say it be from a deep tissue massage, or say you got hit with the baseball, or you ran to the corner of the bed. Um, the quick the quickest I've seen the results is 24 hours. A bruise, it's gone. Literally like I'm erasing it. Rub my finger up the bruise, and like it's starting to speed in the healing process. So in 2 or 3 days, it's pretty much gone. And that's another thing, like, in today's world, everybody wants quick results. I want it now. How quick can you get me better? Well, with this, it's pretty quick. And people say, how soon can I see results? I say you feel a difference after just one session. Now, I'm not gonna say you're gonna be back at 100%, but you'll feel better than you did when you first, got on my table. And that's the thing I like that kind of brings them back. Well, this felt good this time. I can't. Like, when can I get it again? Can I get more? Can I get more? It's like, yeah, we'll set something up. But and it doesn't hurt. People think, is it really gonna hurt? Like, no, there's no pain involved. If there is any pain the next day, I say it's mainly like the discomfort of like the new muscles we kind of turned on, or now they know how to work by themselves. So you're not compensating using, your trap to be your bicep. Now your trap can only just it only has one job to do. So Electrons Plus has allowed me to kind of show people that and help educate them on their body as well, where they don't have to compensate to use other muscles.
Yeah, and it's so important. I can't express this enough. it to use PEMF devices in your health practice, in your health regime, because pulse electromagnetic fields, there's lots of devices out there that deliver it, but a lot of them are really subpar, really, and not targeted. Like the Electrons Plus is very targeted. Like the practitioner can go exactly, well, to the body part that needs it or the area that needs it. And can you explain a little bit how Electrons Plus is different from TENS machines? Because, when I go to, say, a physical therapist, they'll put a TENS machine on you and it contracts the muscles and relaxes them, contracts them and relaxes them. And there is a similar sensation when using the Electrons Plus as well. Can you explain the differences there?
Well, most TENS units go for a what's the analgesic, just go right for the nerve. Like you said, contract, relax, contract, relax, contract, relax. Well, that can be painful if you turn it up too high on a 10 unit and it's just contracting. The relax is not much, and then you're just contracting again. So your body thinks, man, we're doing a workout here. But what the difference of Electrons Plus is that when I touch an area, you're gonna feel it here, but you're gonna feel it run down the whole arm. So think like the whole brachial plexus and the traps, or behind the ears. It's like it's not just right here. You can feel it run down to your fingertips where you put a TENS pad on, it's just stuck one spot, right? So for me, as a therapist, I can go around the whole body and still where my hand is now the electrode. I don't have to be stuck in one spot and just walk away, right? We can get the whole deltoid, we can get the whole bicep, tricep. We can work inside the tricep and get the fingers to move. Or every time with the TENS machine, they're gonna have to let's move the pads again, let's move the pads again, let's move the pads again. Well, now I still can use my hand to do that. And also like using like a grasping device. I use a device called the T tool where it's a still device where you can scrape and move along, and now it's an extension of my hand. So now it's even going deeper, but you can't do that with a TENS device. Also with Electrons Plus, you can treat people in water as well and help with like swelling, say for gout, carpal tunnel, ankle sprains. Another uh, something I use Electrons Plus for that, and you can use it for a TENS device, but again, it's a whole different method of treating the nerve versus treating the body at the cellular level, and that's the main component because the cell is the battery of the body. And if that battery gets damaged at some point, how else are you going to recharge it? And that's what I do with the Electrons Plus.
Yeah, and that's so important to do. That's something I do on a daily basis. I have other PEMF devices that I use. I have a QRS pad that I use to charge up my cell voltage because you need energy to heal. You need energy to thrive. And for many people, as they get older, we see that cell voltage diminishing over time. A child may have like, 120 or 90 volts or millivolts, or I'm not sure the exact measurement. And then as you increase in age, the volts tend to that cell voltage tends to decline.
Decrease. Yes,
Yes.
yes.
And so we need help in charging that back up. And EMF, or the non-native EMF from all the different, Wi-Fi and 5G
Hmm.
cellular, really does a number, I think, on our cell voltage as well, decreasing it, ungrounding us. And this is a way to kind of reground your body.
Exactly. So when I'm treating a client on the table, just how they're getting healing, I'm getting the same healing as well. We kind of complete a circuit.
Yeah, I was thinking you
So
and Chris, my personal is you guys just must be grounded as hell because
yeah, I'm always in a good
I was
mood. Yeah,
thinking
but
that because
yeah,
this is moving
besides
through your
besides
body.
sleeping, besides sleeping on the grinding mat, doing this on a daily basis, like I can tell days when oh man, I haven't treated anyone, but I'm always in a good mood because I equate it to like the analogy of think of yourself on always staying at 85%. You take that in a heartbeat. But it's kind of how I feel all the time at 85%. I'm not really down, don't get sick too much. But I'm always it's just charging my system up. If it goes down to 7, I'm gonna see someone now it's back up again. So I'm steady always on the incline versus going back on the decline.
Okay, fantastic. And so for anyone that doesn't know, can you explain the PEMF technology a little bit, the pulse electromagnetic fields, and what that is exactly and why we need that?
So they talk about grounding. I think it was done by Nikola Tesla back in the day, we'll say. But they use electricity to help heal the body. It's the stuff from the ground. So one of the things I do when I do I've done Electrons Plus like outside on the grass at a golf course. And I'm like, where's your grounding mat? Well, say I don't need one because I'm using the ground and using the tells us from the ground to help heal the body. I mean, using that same electricity to put it back inside you. So another analogy I give is people always think I'm gonna like electrocute them, right? Because oh, you electricity, what you're gonna? No, I'm not gonna electrocute you like that. But I give the analogy like an AED. If you see an AED, when someone heart stops, what do they do? They're gonna do? They're gonna take the AED and shock your chest or heart to get it back beating again. They're sending those negative ions of electricity to get you back to get the heart beating again. When that does, your heart doesn't beat, none of other systems can work, right? So they say, "Hey, clear, give me more juice," and they'll shock you again. Now, okay, now we got something, So that's what I'm doing to your body on a smaller scale, sending that pulsed electromagnetic frequency into your body, because that signal when your brain says, "Hey, we need to move something," that signal has to go to the brain, it go to that muscle. So if we get here and there's no movement, that's a problem. But if I can work other areas and now get the signal to run down, now that frequency is going to the muscle and it's doing what it's supposed to be doing.
So this episode is brought to you by Chef's Foundry. They've got a fantastic line of cookware called P600. It's totally non-toxic. I think people don't realize that when they're cooking, most people's cookware is adding toxins to their healthy food, that people spend so much money on healthy organic food and then cook it in toxic cookware. And so that includes cast iron, which I do not recommend. It adds way too much iron in a form that we can't absorb. People use aluminum cookware, which is very inexpensive, but it's used at most restaurants, giving us tons of aluminum. People are also using ceramic cookware, which can leach toxins into your food. And not to mention the nonstick cookware. It just has so many PFAS or PFAS that is so toxic. It's one of the forever chemicals. So you really have to pay attention to what you're cooking in. So that's why I recommend the P600 line by Chef's Foundry, so that you can have peace of mind when you're cooking and you're not getting any nasty chemicals like lead or cadmium or nickel or PFAS in your healthy food. You can get a special discount for my listeners by going to bit.ly/Myers Detox. So that's bit.ly/Myers Detox, MYERS DETOX, to get an exclusive discount just for my listeners. I want you to be thinking about what you're cooking your food in, and I highly recommend the P600 line by Chef's Foundry. Yeah, and what I love about the Electrons Plus is I feel like when I'm getting a massage, you're able to access deeper muscles that you can't get on the surface level with a regular massage. And that is so important, say, when you're like working on the face and working on the scalp, or just, working on the abdomen, or wherever you're working, you can get into those very deep, intricate, small muscles. Like the piriformis in your butt is very difficult to reach, to access. A lot of people get older, they have a problem with that, tightness in their hips, and you can get down all these deep muscles, and it's just amazing.
Yeah, another good place I like to work that's kind of the wow moment is working the scalenes in the neck. Most people they want to go and dig, but if I hit here and I can get your whole arm to move like Pinocchio, I think we're on to something. But I mean, you other times I could just massage, but there's no movement. But now we can connect the scalenes, the muscles in the neck that go all the way down, to the hand, but the brachial plexus. You talked about like working on the eyes. I've had a client that had a black eye, and I literally took my hand and just rubbed it over her eye, and within 2 or 3 days, her black eye was gone. Another client that had a plate put in a sheet got hit with the baseball and had an orbital fracture. I can work around those plates and pins and still put the electrons plus into the body and help the healing. So now he had sensation back in his face. He can now move his eyebrow, which he couldn't do before. So it's allowed him a lot of access to different places that you can't do again with the TENS device, like working third eye, working the pineal gland, working the back of the head, the occiput, something in there, back in there is like a scalp massage. We can wet the back of your hair and place my hand in the back of your head, and it feels like, a scalp massage, like I'm massaging your brain. Other things you just can't do with, again, nothing against teens, but just I'm showing the versatility that I have with using Electrons Plus.
Yeah, the eye muscle massage is so cute because you can't massage your eye muscles
No.
that are behind your eyes. But so many people have eye strain and they get
hmm
headaches
Yeah.
from that, and they need those muscles massaged too, or those
hmm
relaxed as well. or maybe that's a first world problem. But yeah, I love I love the Electrons Plus so much. And so, is there anything else that maybe we haven't discussed that you want to talk about with the Electrons Plus? Some benefits.
That we
Well, what about
haven't.
scar tissue, for
So,
instance? I mean, how
so
does it
scar
help?
tissue is great. It really does help loosen up the tissue, the scar tissue, and gives a little more pliability. Uh, think of scar tissue as kind of like cement. When wet cement. When they pour cement, you can move your hand around in it, and when it gets hardened over time, your hand gets stuck. So with Electrons Plus, over time, we can help loosen that scar tissue up around there, so the other muscles can become more pliable, and now the signal can get to the muscles. It's great for pre and post-op surgery wise. Say total knee surgery, had a hip replacement. I can see you as soon as you come home, and start the healing process right then and there. You don't have to wait. And again, it's not invasive. I'm not going right on the spot where you had the scar, but those other surrounding muscles will need to be activated because they're going to atrophy at some point. So it'll speed up the healing process. Also works good with broken bones. Could be, broken leg, fractured wrist. There are ways we can put a little TENS pad, a grounding pad inside the cast and let the Electrons Plus heal it from there as well, or just my fingers. So again, while the doctor may say don't move, we can speed up the healing process. There's no moving going on, but we're healing that bone. And Electrons Plus or PEMF has been cleared by the FDA to help heal bone. So that's one of my big success stories as kids, who have a broken bone and doctors, you're out 6 weeks and, I'll see them and, they're back and forth and the bone's completely healed and, the parents like that. So what parent wouldn't want their kid to return to sport, a week or two quicker? You put all that money into it. Why not? Hey, let's get them back a little bit quicker to see them play 1 or 2 games before the summer's over, or, could be the senior year, hey, they're going to graduate, now you're back sooner than expected.
Yeah, I mean, there's so much research that shows that PEMF can heal bones so much quicker. For sure, I've heard, and for some devices, as little as 2 weeks. But if you're using it like every day for hours, I'm sure you need to use it for longer. Yeah, and so what about, using this as part of your practice? So for the chiropractors out there, the massage therapists, the physical therapist, like how can this add to their practice?
It will benefit their practice. Dr. Simon Billingham is the guy that created the Electrons Plus, and he's was a chiropractor. And when I got the unit, he said, "Hey, your practice is going to take off." People think, "Oh man, you're going to be rich," and it wasn't so much I wasn't concerned about the money. I was starting to see cases of things that I've been wanting to see, like drop foot, a lot of neurological things. So it will enhance your practice. Um, and again, in the results world, you're gonna get results a lot quicker, For the massage therapist, if you want to work smarter, not harder, I would say Electrons Plus is the way to go. You still can do the same strokes you learned in massage, but now you can use one hand, but now you're working smarter because now you see this hamstring is not working versus doing the whole leg and doing things that's gonna make you work harder just to try to get a reaction out of that muscle. But now we can touch and see, hey, this is not working. And what I like about it, you can use it in conjunction with other things like cupping, stretching, uh, instrument assistive tools. Like I use the T tool. And it's just going to enhance what you already know. It's not going to take away, it's just going to enhance. And one of the things, the cool thing I like showing people is that the grounding plate that you lay on, when you had your massage from Chris, if we hit a light bulb over that plate, the light bulb is going to come on. That's the energy I'm putting back in your body. If the light bulb doesn't come on, well, something's going on with the light bulb or the plate. And I'm always going to blame the light bulb versus the Electrons Plus. So if I can turn that light bulb on, think what I can do for your body if you're in pain, you're sore, want more range of motion, or you have bruising or something like that. I can speed up that process and make it go away a little bit quicker. I thought, yeah, massage is great, but like, I can do this, but like, I'm not, how many times can I do this and not see a result, right? Or just get, I wanted to make sure they left feeling at least 85% better than when they got on the table. If you went from here, now you're like, hey, I can move my arm. That's progress. And most times for me, sessions last about 2 weeks, like the benefits of it. Like, man, I still feel like you're still touching me and like the machine's off. That means your cell has started to hold that charge. Now it remembers the job, what it was supposed to do. Oh, my trap? This is my main job right here. You're not using the other side of leaning back, it's kind of like the alphabet, A, B, C. You can't spell apple with the B. Can't spell banana with the C. So your body's the same way. We can't have it compensate and try to have the bicep be the tricep or your trap be your bicep. It'll never work. But and with the Electrons Plus, I can kind of see that sometimes with some other assessment testing I do of where you're compensating from. And that makes me work smarter, not harder. But I'm also treating you at the source, not just the site. You say, "Oh, my trap's hurting," but that could come from many other places. Could it be the neck? Could it be the leg? Could it be somewhere else? So that's how I like to treat clients in my session. "Well, that felt better. My back was hurting, but you didn't even touch my back. You just worked on my hips." Well, that's all connected. So
Yeah,
most
that
people
that
have back.
happened that happened to
What?
me where sorry, I don't mean to interrupt. That happened to me where I just kept having these lower back problems. I was like,
Mm-hmm.
Chris, can you do my lower back? He's like, no, 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 it's not your lower back, it's your thighs.
Yeah.
And so he just, dug into my thighs and released them. And I'm like, lo and behold, no more lower back problems or lower back tightness. So it's
Yeah.
not the pain or tension's not always exactly, where you think it is.
Exactly, that is true. Most people will say, "Hey, my back hurts," and say, "Do you sit a lot?" "Yes, I sit a lot." Well, then that psoas is gonna, in a sense, kind of shut off, and then the back is gonna overwork. So, like those days of me digging in, trying to find the hip, like, "Here's your psoas." I don't have to do that anymore. I can literally run my fingers over that muscle junction, and then your leg will start kicking. Once it kicks, we know the psoas, the hip flexor is doing its job. The back muscles can't do that. There's no no kind of osmosis. So now if your hip flexor is doing its main job, what is the back doing? No, I can just be a stabilizer now. I don't have to try to compensate and help you out because another muscle isn't working.
And I can see where this could help so much with calcifications of the soft tissue. This is a huge, huge, huge problem, especially with people, taking too much vitamin D or, just their supplementation or diet is out of balance with their body, or they just don't
Yeah.
have any movement. You
Hmm.
slowly but surely get calcifications. You see these old people kind of hunched over and walking really slow, and essentially their body is becoming calcified. So how does it help with that?
Pushing the electrons in the body, you're gonna help get more blood flow and increase the range of motion. Um, so thinking of someone who's like you're saying elderly, doesn't move a lot. And they're thinking, "Well, exercise, well, I can't really move my arm, but if I can just touch their arm and now it's moving, those muscles are starting to work." Now we've kind of increased their range of motion, the calcification will kind of decrease. Now, there's no blockage and the arm can move more. As I say, you don't move it, you lose it. Well, I can kind of get it to move at a different way than you haven't think I got to do all these range of motion exercises. And you probably can't raise your shoulder, too high. But if I can get in here, say if you're in a sling, right? Doc says I can't move. No problem. I can get here and work your whole shoulder without you having to go do exercises. Or, we can wait till when you're cleared to for range of motion. But it can help reduce calcification because now we're getting movement, more blood flow in there. And now the cells are getting hydrated. And again, you talked about lifestyle and things like that. If someone is, elderly, their battery system is going to be not as charged up as someone that's younger. So it may take a little longer to push the electrons in because what we're doing with the electrons, plus we're pushing different frequencies in the body. If you're familiar with alpha, beta, gamma, delta, we can push those frequencies that are coming through my hand pretty much into you. So that's how we can get you to relax. We can get you to be more focused. We can get the muscles to move quicker. So it depends on kind of what the client needs, but also what I want to get out of them as well, so they can see the difference. And I always show them their quote unquote good side first versus the injured side. Hey, why does this side move like that side? Well, this one works, and kind of this one doesn't. So it does help with especially with calcification, just improve their range of motion in the joint.
Let me ask you something a little bit personal. So, how do you get yourself out of a bad mood? So, it can be hard, really, really hard. And it only gets harder the longer that you're in that space. So, that's why I'm a big fan of today's podcast sponsor, Organifi. They made an amazing product called Happy Drops, and they're little gummies that are super tasty. and they can help make your bad moods better and your good moods great. And so I'm sure I'm not telling you anything new when I say the world is really stressed out right now. You can see it everywhere. In stress and mood related visits to the doctor's office are skyrocketing along with various prescriptions to match. And so if you're anything like me, you're looking for a safe, natural approach to rebalancing your happiness and your stress chemicals without worrying about the side effects. Well, Organifi has given us exactly that, and they're called Happy Drops, and they're my favorite new supplement. These yummy little lemon gummies are made with ginger, with gotu kola, and passion flower, all of which are shown to have positive effects on mood and emotional well-being. Plus, they have a real powerhouse ingredient, which is saffron. So why is that so cool? The compounds in saffron are shown to help your brain modulate its levels of serotonin. And serotonin is one of your happy chemicals, and saffron helps your brain enjoy it longer. Saffron also relaxes you. There's many cultures around the world that drink saffron tea before they go to bed because it helps relax them and helps them go to sleep. So saffron also contains antioxidant properties, which can help you protect your brain from oxidative stress. So that's great for detox. So best of all, there aren't any nasty side effects. There aren't any like bad ingredients, and it's safe to use every single day. So saffron's traditionally very challenging to find in the supplement world. It's difficult to plant and to farm. It's even harder to harvest, and that's why it's one of the most expensive ingredients on the planet. But now, thanks to the superfood geniuses at Organifi, we can all enjoy a real dose of real mood-lifting organic saffron for less than $1 a day. So I'm excited for you to try them. I think that everyone should. I love their happy drops. So just go to Organifi.com/Myers Detox. That's ORGANIFI.com/MYERSDETOX and get your happy drops today. And when you use my discount code Myers Detox at checkout, you're going to save an extra 20% off. So again, that's Organifi.com/Myers Detox. I want you to go out and try Happy Drops today. Like I said, I love them. I've been taking them on a regular basis to help me to go to sleep at night, to help me kind of relax and get in the mood. You've got nothing to lose but your frown. Yeah, and I love that I have this resolution of this weightlifting injury because I'm such an athlete. But I have this weightlifting injury I had, if I mean, for so long, and it's pretty much dissolved. I don't have any more problems with it. I'm not constantly injuring it, just doing lifting normal things. And I think I just had, a lot of scar tissue there that has been loosened up and released and infused with more energy, if you will.
Mm-hmm.
And I don't have a problem with that area anymore. I'm very thankful.
Yeah, and as you see, that could be an older injury, but we can still treat that no matter how old the injury is. I've treated some clients that had C-sections, and it doesn't matter, if your kid's 25, 35, or it could be, 3 months. You still can treat that injury regardless if it's fresh or if it's something chronic that's been going on for a long time. You can still get benefit from the Electrons Plus, as you see from and the healing aspect of it. And that's my main thing with the Electrons Plus. It's a healing. It's healing people. Not gonna say I'm healing you, but I would say I'm helping. But so if I'm helping you feel better, that's a win. That's a win, you know. Um, and that's one of the things about it. Again, I don't have to. Again, I would say work as hard as I gotta get deep tissue. I gotta ergonomically. That's not good for my body. I won't last long. Trying to lower my table and depending how what they want. That's gonna affect me. So now this has increased my longevity as a therapist and as a body worker as well.
Yeah, and that's such a huge issue because say when I have had, friends of mine that are chiropractors or my physical therapist that was in Mexico, he's brilliant intuitive healer, but he was constantly injured, because
Mm-hmm.
he's just digging so hard and working on so many patients, invariably you're going to get injured if you're just really physically digging into people all day long
Yep.
for months and years on end. It's very physically taxing. So I could see where the Electrons Plus would just be so important if you have a really active practice and
Yes.
you do a lot of deep tissue work. It's just gonna, shave your workload and reduce your injuries so
Yeah.
much.
Yeah, and you think with, him pushing like that, there's no give back. You're doing all the pushing, you're doing all the work. They're laying there. Now with Electrons Plus, there's a little give and take. I can alter the frequency to say, let's go a little deeper, let's go a little more superficial, but I'm not having to keep pushing, 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 thinking their body's going to give me something back. The deeper you push, the body's again is going to treat that as threat. We're going to protect myself. We're going to close up. We're going to spasm. We're not going to keep hurting because you want to keep pushing and try to get a reaction out of us. I can rub my finger over an area and get it to turn on and like, oh, that didn't hurt that bad. Because with the Electrons Plus, it's putting your body in that parasympathetic state so it can relax. You've noticed from your sessions, oh man, it's not that intense at all. It's pretty relaxing. Most people want to take a nap when I get done with the session because it's that relaxing. Their body feels that good. It feels light. It feels lifted. It feels easier to move through space because now the right muscle is doing its job, especially like for the hips. Talked about the hip flexors. Feels like someone's helping to pick their leg up. That's a great feeling where your leg doesn't feel like heavy, like it's waterlogged because you're trying to drag it around. So that's another benefit that they feel lighter and feel like they can do more.
Yeah. Yeah, and so I want to talk a little bit more about scar tissue
Okay.
because I think that's such a big problem for so many people because, as you get older, so you've had surgeries or injuries, those scar tissues will tend to, they can grow, they can harden, and they can dramatically interfere not only in physical functioning, but in the bioenergetic communication of your body as well, where your body, you have a lot of communication that impairs physical functioning in this energy field, and scars really impede that like that bioenergetic information traveling over your fascia,
Mm-hmm.
where its fascia is not just just a matrix that goes around your muscles. It's actually a communication highway
Yep.
for your body, and so that scar tissue, it's really important to be thinking about ways that you can improve the functioning and break down the scar tissue as well.
So again, with the scar tissue, with any scar you had, even if it's a small appendectomy scar or a scar from, you fall off a bike, the brain is going to go to that scar first because we got to go protect that scar. And then it'll go to the muscle. The muscle that you want to use is probably secondary. So when treating with Electrons Plus, I always try to go with treat the scar tissue first, no matter how old or where the scar is. If you have, say you have your foot hurts, or you have like Achilles, your calf is tight, but you've had a Achilles repair. Um, I'm gonna work that scar first to help open up your calf because it's the brain is going there first. We got to keep helping the scar. Like you're saying, releasing the scar tissue is gonna help get more, I guess, and create that frequency going, you said, to that highway. And everything can go where it's supposed to go. I speak more of analogy than a bunch of anatomy talk, but like you said, if that highway is clear, everything can go there. And I equate it to like a kink in a water hose. When you turn on the water hose, water's gonna spray out. So to me, scar tissue was like we put a knot in that water hose. Two things are gonna happen. One is that pressure is gonna build up where the kink is, and that could be your scar, right? So that everything's just sitting right there, nothing's going. The water's not going out. Other thing is that water's just gonna drip out. It's still gonna flow through, but it's not as powerful as it could be. So when they're releasing that kink and pushing those electrons in there, now when the kink is released, now that water starts to spew out how we started. So it helps reduce where the brain wants to go to the scar tissue. We can help reduce that. Now we can go to the muscle. Now the scar tissue it's not blocking that message of getting to that muscle. And that's what scar tissue is kind of like a block, like 5 o'clock traffic. Right? Oh, we gotta sit here in traffic. Can we go to a detour? Yeah, you can, but it's gonna take a while. Versus kind of letting it wait and go through, okay, now we got through this accident. Now we can, now we're traffic is clear. So with Electrons Plus, we're allowed to help that signal keep getting in there. Because most times over scar tissue, they're like, I don't feel anything. So give it some time. Or we can adjust the frequency and say, okay, now I feel something. Now, okay, now there's progress being made. Now I feel it down my hand. Now, oh, now it's in my fingers. Well, for the scar tissue, shoulder surgery, it's just kind of stuck right here. That I just can't really move it like I need to. It just feels weak. Working that scar will turn on these other muscles. You think you got the deltoid, your rotator cuff, everything is encompassed inside the shoulder. And people most think of scar tissue, they think of just the scar, right? That you just see, that's visible. But think of the underneath there like Spider-Man's web. It's gonna attach on more than just that one area. It's gonna get a whole bunch of things underneath there. And Electrons Plus allows me to get there at a deeper level.
I want to say a couple words about one of our Myers Detox podcast sponsors, Qualia Senolytic. So it's a cutting edge formula designed to help your body eliminate senescent cells, also known as zombie cells. So these outdated cells, they hang around, draining your energy and slowing your workout recovery and causing all kinds of havoc and mayhem. So, backed by clinical research, Qualia Senolytic uses 9 plant-based compounds that support joint comfort, sharper focus, and better aging naturally. And here's the kicker: you only have to take it 2 days a month. Simple, backed by science, validated by research. You can try it risk-free with a 100-day money-back guarantee. Go to qualialife.com/Wendy. That's QUALIA life.com/Wendy and use code Wendy to get 15% off. You want to try Qualia Senolytic. This is something that I've been taking. It's part of my anti-aging protocol because getting older doesn't have to feel like it. Yeah, so important. I think people don't realize how problematic scars really are in a number of ways, and they really need to
Mm-hmm.
find ways to address those and break them down.
Yeah.
But yeah, I have to say I'm really looking forward to my eyeball massage next time Chris comes over on Tuesday. But can you talk a little bit about some testimonials or some stories of clients and how you've helped them with the Electrons Plus?
Oh, yes. When I first got Electrons Plus, I was working at a country club, and I was seeing a lady. She had like carpal tunnel or golfer's elbow. She played a lot of golf, a lot of golf. She said, "Well, I'm afraid you're my friend. He has drop foot, so he couldn't really walk." So he literally limps in my office, on one leg. He says, "Man, I just want to be able to walk, go play golf, and just go run a half marathon, do a 5K something again." Using Electrons Plus, I was able to get his foot to start moving again. Literally was just hanging there. And if you've seen the movie Usual Suspects, he kind of walked around like Kaiser Sose, kind of limped around. And when I got done, he's able to do a calf raise, and he walked out of the session. No limp, no nothing. And I saw him the next week at a University of Houston football game, walking up and down the stairs, no issue. That's one of my favorite ones. And
I said you're essentially just kind of reconnecting the nerves, like you're just getting
yes,
the
yes,
nerves talking
yeah,
again. And for some, it can be just as simple as that. That's what you need to restore
exactly.
function. You're not going
Yes.
to get that at the doctors.
No,
Not
you
going to
won't.
happen.
Yeah, you won't. And it's sad to say that most times the doctor's going to be conservative. Oh, just rest it. But if you rest something, you're not moving it. There's no signal to the brain saying, "Okay, I can move a little bit." You know, there's none of that when you rest it. So I'm a little proactive, a little aggressive. I want to do what I can to get you to move a little bit. I don't want you sitting there being dormant. And that comes from my sports medicine background. Like when they would come to the athletic training room, you're gonna, oh, if I see you, that means I can't play. No, 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 no. My job is get you back on the field of court as quick as I can. And that's what I can do now with Electrons Plus. And I had another client that she had fell off a bow dock and her leg was just blue and purple, just bruised up. I mean, that's like, man. So literally in conjunction with used Electrons Plus and some red light therapy, that got rid of her bruising within 72 hours. You would not have known. And that was just one session I saw. I saw her on a Friday. She came back Monday and said, "Look at my leg," and it's clear. It was clear as can be. And I think another one of my favorite ones, which goes back to 7 years ago when I saw the Electrons Plus on the website or Instagram or Facebook. This guy had a tremor and he could not hold a bottle of water. He worked the shoulder and the tremor had reduced. Well, I had a client probably now about 3 years ago. I worked on the son-in-law and worked on the daughter. And I was like, well, man, I think this could help my mom. Well, the mom had early Parkinson's. So she had a tremor that was starting to form. And she could not hold the water. She had to take her other hand and say, I had to stop. So worked her neck for about an hour, both sides, and we got done. The tremor was gone. Like, I'm talking like 90% gone, where she could take the ball of water up and down. She's like, "Look, I can type on Sudoku now." And it took her. She called me back 3 months later and said, "Hey, the tremors come back a little bit." I'm like, 3 months? And it wasn't enough to where it was like, "Hey, not the water," but she liked to bake and she could barely hold like a half a cup of flour. And I worked on her again, and it was like 2 months before she called me back. So those are the long lasting, like, testimonies that I like hearing that, like, it lasted that long. Again, that's without medication. And I'm not saying, that's the end all be all, but that's all we did was Electrons Plus, and we have the proof right there. We have the footage to see, like, that's all we did was Electrons Plus, and the before and after was like, that's it. Yeah, it was like you said, that is simple, just getting that system recharged, getting that nervous system to re-stimulate to where it's not like, "Oh, I gotta get here." Well, again, with that tremor, we're calming down that nervous system, so now the muscles know their job. The nervous system is not taking over. I can be the muscle too, like, you really can't. Nerve, you're supposed to give me a sensation. Muscle, you're gonna help me move. So that's probably the 3 ones that I'm pretty proud about. And also, age is not a factor really. Um Worked on a 10-month-old baby that was constipated, and I have a client now that she's now 99 that I've seen since she was 92. So you talk about a younger battery system to a very older battery system. But again, the lady now that's 99 can still walk her dog. She can go, in the garden. She still swims. So she's still very active. So again, keeping that battery system charged up has helped her quality of life.
Yeah, and I could see where you mentioned this, the 10-month-old baby, you're helping their digestive system. I mean, I
Mhm.
could see where this could hold so much promise for people that have gastroparesis or
Oh, yes.
they have constipation or
Mhm.
their vagus nerve is just not innervating their digestive system or their peristalsis is just slowed for whatever reason. It's just all the nerves talking to each other and the vagus nerve communicating from the brain and back. You can innervate and give energy to a lot of these nerves to improve functioning on a lot of different levels.
Yeah, and that's one of the nerves I work probably the most often. I start with the vagus nerve. No matter what you have going on, hey, it's my knee. Okay, let me work the vagus nerve first because that's the nerve that controls the whole body. Well, I mean, helps relax the whole body per se. If you're tense, hit the vagus nerve, your body's gonna go in the parasympathetic state and start to relax. So now I can go work your knee or other areas, and now your body will accept that healing. And you're not guarding, we're not playing tug of war, like, oh, that's gonna hurt. We're going back and forth. Now your body's accepting of what's the healing that's gonna come next with the electrons plus, because now your body's relaxed. Nothing feels threatened, like, oh, it's gonna hurt or painful. And that's one of the that man, that's a big one we hit a lot. The vagus nerve, I mean, it gets the whole body just to start to relax.
Yeah. Yeah. And then also when you're, practitioners using the Electrons Plus, I noticed with Chris, he was putting it on different settings. Like you can do ones that are really strong, that
Mhm.
really get that muscle contracting. And there's ones that are very soft, where there's just a very subtle kind of reaction to the muscle. What are the different levels?
The different levels or the different frequencies, they're, let me get this right, alpha, beta, gamma, delta, theta. I think that's all of them. Hope I'm not missing one. But each, frequency does a gets at a different rate, or think of it as pulses per second. So delta, as people think like delta or REM sleep, that's like 5 to 7 pulses per second. So you'll see like 5, 1, 2, 3, 4, 5. Then we can raise it up and go to gamma, and that's pretty high. It's higher than like 50 pulses per second. And that's going to be quicker, deeper, getting that muscle to fire. But also you have to think about as a clinician and therapist working, sometimes you don't want to always go right to the higher frequency because you got an injury, their body cannot respond to that quick enough. Like, if we do 3 pulses per second, that's 1, 2, 3, your body can absorb that, and, okay, I can do 2 and 3, but the higher you go the frequency, the more that's gonna move, and your body's gotta respond to that. Now, you had an injury, is not ready for that higher frequency yet. So, we can play around with the different frequencies because, like, the lower ones can get you to relax a little more. The higher ones can get muscles to move that may not, be fired, and we can turn up the frequency and get it to move a little more, or just get some different feeling and get some movement going down certain body parts. certain areas, like down the leg, or hey, I don't feel anything in my toes or my feet. Well, we can change those frequencies and see how we can get that your body to respond to that.
Have you had success with neuropathy or people are having numbness and
Oh
tingling in
yes,
their
big time.
extremities?
One of the first clients I had, he had neuropathy. He had a stroke that I met when I was working in a PT clinic. And first time I put it on him, I put the machine on his forearm and his hands, nothing. Because I think your machine's broken. I said, well, give it some time. So I saw him the next week, and he's like, look, you can see my fingers moving. It's moving. It's moving. So the more we kept doing it, hey, my whole hand is moving now. My whole hand is moving. And he said one thing he knew that was working is because he could take a pair of scissors and just scrape in his hand, say, I don't feel anything. After about 3 weeks, he's like, I can feel that now in my hand. So when they're robbed, it's very good for that. And if someone doesn't want, like, I don't want anyone touching me, well, there are ways we can treat you in water. Now, water is also a great conductor of electricity. There's a probe we can put in water and put your foot in water, and now you're getting the electrons to the water, and we don't have to touch anything. We don't have to touch you. Now that water's it's been the conductor, so now your whole ankle, arm, or wrist is getting electrons into the area, and that's going to help turn things on. Say people that had gout or carpal tunnel, that I've had people with arthritis that come in like this, and I get done, they're like, oh my gosh, I can move my hands now. They can clap, or now they're like, hey, I can at least text on my phone. So it's very good for, neuropathy and things of that nature as well.
Yeah, and I can see that be so helpful in the water for people that are in pain or have had
Mhm.
surgery or it's too painful to touch and
Yes.
they could still get benefit.
Mhm.
Yeah. Yeah, so I just like I said, I'm really thrilled I was able to do a podcast with you because I've gotten so much benefit and so much help keeping me back and because keeping me kind of back in the game if you will,
There you go, yeah.
trying to get in
Yeah.
shape and stay in shape and just felt like I was constantly plagued with injuries and
Mhm.
which happens to women when they go into menopause and they have a reduced estrogen, they have a lot more musculoskeletal issues
Yeah.
and it can create a challenge when you're trying to lift weights a few times a week and play pickleball. And so Chris, who's my personal masseuse, has been helping me keep me back in the game with the
Yeah.
Electrons Plus. So why don't you tell us what your website is, where people can learn more about your work and get a massage or work with you?
My website is, customneeds.net. That's, customkneads.net. You can find me on Instagram. That's custom needs PR. You can find it right here. Here's my little logo thing right here. They can see that. Yeah, and I think also has my website, everything right there as well. My practice is mobile, so I can come to you. People like the convenience of coming to their homes. Um, Most sessions are usually 90 minutes, but it's full body. And if we don't just I don't just focus on one side. I'll do, whole body from head to toe.
And you're in
Yeah.
Houston, correct?
Yes, I'm in
You're in
Houston,
Houston,
Texas.
Texas.
Again, I go anywhere in the state of Houston. But you call, I come. Just give me access to an outlet and place to put out my table, and we're pretty much good to go. And I can treat anyone. Also, I can also treat pets. I've treated a couple dogs as well, so that's been pretty cool too. The two dogs, three of them, two of them had ACLs and one had hip dysplasia. And I treat the pets just like we would do the human. You just have to wet the fur. But I mean, they got benefit from it just as we do it as humans. So that
Oh,
was a
I'm
pretty cool
sure.
to find that as well.
Yeah, lot of stressed out, tense doggies out there that
Yeah.
need some help. I might have to Chris do my cat next time he comes. Poor my cat's limping around and got his butt kicked outside. But yeah, well, thank you so much for coming on the show. I've been wanting to do, I don't know why I never thought about doing a show about massage, and it's such a central core component of my health regime. So, so happy we talked about this. And another thing I wanted to mention was that one of the benefits of massage is mobilizing a lot of toxins and waste tissue in your muscles. And I do ionic foot baths. And so I do
Okay.
those on a
Yeah.
regular basis and kind of see what comes out in the foot bath. But after I get a massage with Electrons Plus, there is so much more stuff coming out because so much stuff gets mobilized. So it's so good for just general, like physical detoxification of your muscles as well.
Yeah, because just like you're saying earlier with people's battery system, as we say, if you're if you're not hydrated, your cell's not hydrated. So then that's going to take the electrons a little bit longer to get certain stuff to move, and that's going to show up in your iron foot bath as well. Dehydration, things like that. So Electrons Plus also being that diagnostic tool, we can see, hey, something's not right here. Are you drinking a lot of water? Are you eating right? Hey, did you drink last night? Hey, are you a heavy smoker? Those things will play a part in why your body might not move how it's supposed to. So those a lot of other factors that come into play, not just, oh, you know what, you may look fit, but there are other things that could play a part in how your body's going to respond to getting the system charged up.
So for anyone listening that really wants to detox their body, go to heavymetalsquiz.com. I created a quiz for you. It only takes a couple of seconds. Based on some lifestyle questions, you can get your toxicity score and get a free video series that answers all of your frequently asked questions about how to detox your body. Check it out, heavymetalsquiz.com. Yeah, and I think it's so important to just do a flush of your
Yes.
muscles, like whether it's your lymphatics, your soft tissue, your muscles. You need to just flush that like once a month, in my personal
Mm-hmm.
opinion. You've got,
Yeah.
and even people that maybe don't like the physical touch or they don't like typical massages, you don't have to do a deep tissue massage to
Mm-hmm.
get the results beyond the
Yeah.
results of a deep tissue. So this is great for people who maybe typically don't like massages.
I had a lot of a couple of minutes. I don't want anyone touching me. But I tell them I don't have to massage you like I guess like they're thinking. I can just touch a spot and you'll feel it go down the rest of your body. I can just touch certain spots where you're sore, and I pretty much done my job. So I've gotten them out of their stigma. Oh, it wasn't that bad. I see a lot of people like, hey, I know a lot of women like, hey, who's that guy that keep coming to the house? Well, can you work on my shoulder too? I'm like, oh yeah, I should have been calling him years for my golf game. So I don't have it's different than your normal massage, but it is massage. It's just like a supercharged massage using the Electrons Plus.
Yeah,
So
yeah, that's
now
a
you're
very
gonna
good
feel
word
that
for it.
come through your hand, and now it's just gonna be a big difference. You can feel the muscles move. There'll be like also some revert patterns, like, "Hey, I didn't know you hit my shoulder, but I felt it in my hip." There's probably a connection there. And Electrons Plus will find that some shape, form, or fashion.
Yeah, yeah, and when I first met Chris and I got this massage, I was just went to my gym and I was like just signing up for a massage, and then he said, "Hey, do you want to do this Electrons Plus addition to the massage?" Like, sure, that sounds really cool. And when I was getting that massage, I just heard the angels sing. I was like, "This is the answer to my
Ah,
prayers. This is what I've been
yeah,
needing, to
yeah.
get my body to back to where I just had lost so much, physical functioning to where I was afraid to go to the gym because I thought I was gonna injure myself, and I was so sick of it because I love working out and being, physically active, and I had just been really struggling with that, and I'm back in the game. I don't have any of these physical issues. I'm so thankful for it. So, thanks so much for coming on the show. And again, what is your website again?
Customneeds.net, customkneads.net. And thank you again for having me. And thank you again, Chris, for also hooking us up for this podcast.
Yeah, and so the listeners, you can contact Arthur to do a massage, and also my personal masseuse. His name is Chris Santee. You can check him out at acquiredtouchmassage.com, and you guys will travel. And
Yeah.
so, thanks for coming on the show, everyone. I'm Dr. Wendy Myers. Thanks for listening to the Myers Detox podcast, where we have experts from around the world showing you how to up level your health. And we don't talk about the basics on this show. We talk about more advanced topics like, detoxification, health issues caused by heavy metals and chemicals, bioenergetics, anti-aging, and things like that. So thanks for tuning in every week, and I'll talk to you guys soon.
The Myers Detox podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.